A seizure is an involuntary change in behavior or neurological status due to the abnormal activity of the central nervous system neurons, often described as a form of idiopathic epilepsy. It is most commonly seen in dogs and cats, estimated to be seen in 1 to 5% of the dog population. Some breeds are genetically more predisposed to having seizures than others, such as boxers, border terriers, and Cavalier King Charles Spaniels. The cause of seizures is often unknown, but it can occur at times of changing brain activity, such as during excitement, feeding time, falling asleep, or waking up. Signs can also be triggered by other underlying conditions such as liver disease, kidney failure, brain tumor, brain trauma, or toxins. Animals undergoing seizure can show a wide range of different clinical signs, such as shaking, salivating, whining, losing awareness or consciousness, losing control of their limbs, muscle contractions, rotation of the eyes, involuntary vomiting, urination and defecation, unresponsive staring or hallucinations, and/or behavioral changes such as pacing and aggression. Seizures are known to occur in phases. Stage 1, the pre-ictal phase. In this initial stage, your pet may show changes in their behavior. They could suddenly become afraid and hide, increasingly anxious, whine, shake, or they begin salivating. These signs appear as if your pet is sensing something is about to occur. Stage 2, the ictal phase. The ictal phase is the stage where the seizure actually occurs. The duration can vary between individuals, and the extent of the seizure can be minor, such as being as simple as losing awareness, or major, such as losing consciousness and control of limbs. The inability to control bowel and bladder, as well as excessive salivation, is also common during major seizures. The final stage is the post-ictal phase. Following the seizure, your pet will appear confused and disorientated. They will often be seen pacing and generally restless. What do you do while your dog or cat is seizuring? When your pet is showing signs of a seizure, it is important to avoid contact with your animal as they are in a mentally altered state and are not in control of their behaviors. Ensure they are in a safe and soft area to avoid further injuries. Remember that it is not possible for your pet to swallow their tongue during an episode. Therefore, under no circumstances must you place your hand in or near your animal's mouth. Following diagnosis, what can you do to help manage a seizure? If your pet shows any of these signs or has repetitive seizures more than 6 weeks apart, it is important to contact your local veterinarian as soon as possible to discuss treatment options. To assist in diagnosis, it is also helpful for your veterinarian if you have as much evidence as possible. Keep a logbook and record the time, how long the seizure goes for, what your animal does before and after an episode, and how it is managed thus far. The survivability of the condition is heavily dependent on the quality of life and environment that your pet is exposed to. Stress is a major factor to developing seizures. Therefore, once diagnosed, it is best to keep your pet as stress-free as possible, ensuring their environment is kept quiet and calm to prevent reoccurrence. It is important to understand that once anticonvulsant medication is started, it must be given for life. If discontinued, there is a greater risk of developing even more severe seizures in the future. In dogs, the two most commonly used medications to treat seizures include phenobarbital and potassium bromide. Treatment for seizures only typically begins after your pet has had more than one seizure a month, multiple seizures where one is immediately followed after another, or where grand mal seizures are severe or prolonged in duration. For dogs suffering from seizures, the prognosis can range from negative to positive. It all depends on the causes of the condition and how soon the signs are treated. For example, a dog or cat with primary epilepsy can be managed with medications, whereas a dog or cat with a brain tumor that would require extensive surgery is harder to treat. In some cases, medication will be required to manage this condition. Your veterinarian will discuss the different doses or types required according to the signs presented by your pet. In order to treat your animal's illness, a consultation with your veterinarian to assess the causes of the seizures is necessary. Testing such as pathology and neurological examination will be required, as well as ruling out any other possible diseases.